going to do, this topic is understanding ostomies and ostomy care. We're going to go through some of the important stuff. This subject, we don't always come in contact with colostomies, and so it's good to be reminded about what you can do and the different types of ostomies that are out there. How many of you guys see ostomies? Do you see ostomies?
We do.
Yeah. Okay. And are you emptying them?
If it's not a breathtaking new one, yeah,
Mhm.
the nurse will tell us.
Good. And changing the bags?
Mm-hmm.
Yeah. Okay. Good. All right. So we'll just.
Are we supposed to change the bags?
You can.
Really?
Yeah. It is within your scope. Not the appliance. It's not the.
Emptying it, but not changing it, right?
Right.
Rinsing the bag.
You can
Bag.
change the bag, but
But not.
not the part that goes to the
Oh,
skin. Mm-hmm. Yeah.
That's the easiest part.
Take
Take it off, yeah. Instead of,
Right. Well, the trickiest part is figuring out which way you're going to place the bag once you put it back on so that it flows properly. Okay, let's go to the first page where it says Carol gets a crash course. I'll read this to you. It's interesting. The year that Carol turned 50, she watched a television program during which Katie Couric got a colonoscopy. It showed a special camera that looked inside the colon. On the show, Katie explained that screening for colon cancer is something that everyone should do at age 50. Carol made the appointment, and 2 weeks later had a life-saving surgery to remove a cancerous polyp from her colon. The doctor told her that she would need to have an ostomy. He explained that an ostomy is a surgical procedure that creates a special opening in the body. The opening is called a stoma, connects an internal organ with the surface of the body. He told her that most ostomies are created to treat bowel and bladder problems, and that her ostomy would be called a colostomy because it would create an opening to her colon. Carol was nervous and frightened when she learned that after the surgery she would need an ostomy appliance, a plastic pouch attached to the skin to collect her bodily waste. A special nurse called a wound ostomy and WOCIN, or WOC nurse for short, visited Carol and explained the ostomy appliance to her. She taught her how to empty and change the pouch and gave her advice on getting back to normal routine. Although she was nervous, Carol learned to care for her ostomy and even joined an ostomy support group so she could meet other people in her community who were just like her. Katie Couric's husband died of colon cancer, so that's why she's a big advocate on that. So the digestive tract is a hollow tube that begins at the mouth and ends with the anus. Food is swallowed down an esophagus mixed with the stomach and digested in the small intestine. Waste enters the large intestine as a liquid, and any excess water is absorbed by the colon. The remaining waste is eliminated as solid feces. The urinary system consists of 2 kidneys, 2 ureters, and a bladder and a urethra. The kidney filters the waste products from the blood and changes them into urine. From the kidneys, the urine travels down each ureter tube and settles in the bladder. It's working now. It seems to be working now. I put it down, it was 78, but I can feel it now. I must have kicked on. Thank you. When the bladder fills up, the urine is eliminated from the body through the urethra, where ostomies are located. And this is it's interesting because you'll hear all these different names and now you're going to know where they go. An ostomy in the trachea and windpipe is called a tracheostomy. An ostomy in the stomach is called a gastrostomy. A colostomy is located in the colon. An ileostomy is located in the small intestine or the ileum. And a urostomy is located in the urinary system. Makes sense, right? Okay, let's go to the next page. I'll let you guys read this part on your own, the difference, just the comment, how you compare the colostomy, the ileostomy, and the urostomy. You can read up on that. Let's go to the next page. We're going to do that after this ostomy surgery because that's probably when you're going to see them most with your patients. Hopefully you'll get them even further after they get their surgery. So after ostomy surgery, to assist clients who are recovering from ostomy surgery, make note of your client's intake and output as ordered so that the doctor can know as much waste being eliminated through the ostomy. Watch for signs of infection, including fever, pain, and redness at the stoma site, and report that to your case managers. Help your clients follow any special diet that has been prescribed for them. Doctors usually recommend a bland, low-fiber diet for a month or two after surgery. Understand that your clients may be grieving over the loss of their normal bodies. It may be difficult for them to adjust to a new self-image. Keep in mind, people with ostomies become upset or embarrassed if their stomas produce noise or odor. You can help by letting your clients know that you are knowledgeable about ostomies and that these noises and smells are perfectly normal. By maintaining a positive attitude and professional manner and a sense of humor, you'll help your ostomy clients feel good about their bodies. Let's go to the next slide. Okay, ostomy care procedures. So I did ask, and you guys are able to do the ostomy care through your state license. What you need when you're providing ostomy care is your paper towels, a bedpan. Sometimes when I would do the care, I'll get a chuck. We have that beside, so you can catch anything from leaking, and then put your ostomy pouch in there and roll it up. Make sure your gloves. Wash your hands and put on the gloves. It's a clean procedure, it's not a sterile procedure. Unclap the pouch. Drain contents into the toilet or bedpan. Measure, assess the character of the output. If it seems to have blood in it or things like that. If you see pills in it, pills that are not being absorbed will still come out through there. And report those to the case manager. Thoroughly clean the bottom 2 inches of the pouch inside and out with a damp paper towel. Apply the clamp 1.5 inches from the bottom of the pouch. Fold the end of the pouch over the open clamp once and close the clamp securely. So make sure you only fold it over once. Flush contents down the toilet, rinse the bedpan, remove gloves, wash hands, and document. Changing the pouch. Wash your hands and put on gloves and place the disposable bedpan under the client. Remove the ostomy and empty the contents into the bedpan. Measure and assess character of output. Wipe the area around the stoma with toilet paper and place the toilet paper in the biohazard bag. Using a washcloth and warm soapy water, wash the area by wiping down in one direction away from the stoma. Apply clean ostomy bag and make sure the bottom is clamped. Flush contents down the toilet and rinse the bedpan, remove the gloves, wash your hands, and document the procedure according to your guidelines. Ostomates may have problems absorbing medication. Some pills may pass through the body before they dissolve. If you notice all or part of a pill in a client's ostomy, report it. And some medications cause digestive side effects such as constipations and diarrhea. It's definitely important to report if a patient has diarrhea or constipation so that we can make sure that we medicate properly. Or a patient could also be dehydrated, which could also cause some of that. Some people put aspirin in their pouches to help control the odor. This is not a good practice since it can cause the stoma to bleed. go to the next page. And how about we start over here with Grace and work our way around and have everybody read under basic ostomy care tips. Page 7. Right here. And just add air.
Just add air. Tell your clients to leave a little bit of air in their ostomy pouch after emptying it. The air helps urine and stool to flow down into the pouch instead of running sideways or underneath the adhesive wafer.
Smoothly have ostomy pouches may be applied while your client stands or lies. However, make sure the client's skin isn't wrinkled under the new pouch, or the pouch cells may be broken when the skin is stretched out.
Be prepared, encourage your clients to take extra pouch tips with them. But remember, in an emergency, a rubber band will do the trick. Where are you at?
Sticky scissors.
Sticky scissors? Sticky scissors?
If the scissors get sticky when your client cuts adhesive wafers, try cleaning the scissors with rubbing alcohol, the lubricant, then with KY jelly.
Water and soap. Are you responsible for cleaning out reusable ostomy appliance? Try using a watering can with long curved spout. Then consider soaking the pouch in denture cleanser.
Cleaner.
Cleaner.
Got ham? Some people find that spraying the inside of a pouch with non-stick cooking spray helps the contents slide easily out of the pouch.
Assuming it's disposable, right?
Thank you, you should work in radio.
Thank you very much.
Can it help your clients remember to put the lid back in their ostomy base after an appliance change? If you left open to, the base will be dried out.
Keep cool. Make sure your clients store their ostomy supply away from warm, humidity places if exposed to heat, and appliances may melt.
Keep track if you are present and one has changed his or her pouch, make a note of the date, and then write the date on a piece of tape around the appliance.
Season change and so do appliances. Weather has an impact on ostomy appliances. During the hot summer months, most ostomies find that their appliances need to be changed more often since the warm weather tends to melt the skin wafer.
A lukewarm response. It's better to use lukewarm water for rinsing and applying. Hot water tends to seal the odor into the plastic.
Empty it out. Most ostomies need to empty their pouches from 3 to 6 times each year.
Each day.
Oh, sorry, my bad.
Yeah.
Ostomy pouches must be emptied more than often. Colostomy pouches due to the
Looser stool. Ileostomy pouches instead. Fold it. Tell your clients to fold the end of the ostomy bag inside out before emptying the contents. This keeps the end of the bag clean and odor-free. Burp it. Intestinal gas can inflate an ostomy pouch like a balloon. Encourage your clients to regularly empty the gas from their pouches. They really do that. They have like a balloon.
Isn't there something they put in there now to eliminate the odor or keep them?
It's like a charcoal kind of thing, yeah.
Okay.
You know, not all of them have it, but some of them do.
Okay.
Some of them have it actually built in, they don't have to add the drops or anything. But, They do. We wanted to stay professional for those clients. Even though it smells, you don't want to let them know. All right, here's some other personal care tips. I'll just read a few off. Watch those zippers. If you help an ostomate get dressed, be careful with zippers. It's easy for a pouch to get caught in the zipper. Empty those pockets. Encourage your clients to be careful of what they put in their pockets. A ballpoint pen, keys, nail file, toothpicks, or other sharp objects can puncture an ostomy pouch. How about let it all hang out? Pantyhose and girdles won't hurt the stoma, but they may slow the normal flow of waste or cause the pouch to lose its seal. Boxers or briefs. If a male ostomate complains of his pouch collides with his genitals, encourage him to attach a bag so that it angles slightly towards the side instead of straight down. In addition, suggest that he wear briefs, not boxers, to hold the pouch in place. Cool off. In hot weather, ostomates may be more comfortable if they wear protection between the pouch and their skin. This prevents skin rashes caused by sweat. A pouch cover may be handmade or may be purchased. Deodorize. There are ways to deodorize an ostomy. Some deodorizers are taken orally and some are put into the ostomy pouch. However, remind your clients that it is possible to overdo the deodorants. They may be so worried about smelling bad that they end up smelling too much like air freshener. How about walk it off? Regular exercise is good for all your clients, including those ostomy. Encourage them to exercise as tolerated. Taking several short walks every day can be a great way to begin an exercise program. All right, let's see. I'll pick a few more out, okay? It shrinks. It's normal for a stoma to shrink during the first few months after surgery. Your client's stoma may need to be remeasured so that appliance will continue to fit well. And if you notice that, let your nurse know that, because it can continue to shrink, and if the area, the wafer is too big, it can cause an issue with too much skin showing or being the stool or urine could be touching the skin and causing irritation. So if you notice that the stoma is shrinking but the wafers are still big, let the nurse know so she'll already notice that, but it's always good to have a team of eyes out there so she can order something new. Know the signs of infection. If your client complains about any of these stoma-related skin problems, tell your supervisor right away. Painful, moist lesions, red, itchy patches, swollen, bleeding areas, raised warts around the stoma, or skin that feels warm and tender to the touch. Let's see. Take a bath. Your clients may bathe with or without their ostomy pouches. Soap can't hurt a stoma, but it's important to rinse well. If your client prefers to bathe without their appliance, try to schedule a bath time for them when their bowels are less active. This reduces the risk of an accident. That's good for that one. Nutrition tips. Eat, then drink to be merry. Many people find their stomachs gurgle less if they eat solid food first at mealtime, then drink fluids. Nibble and graze. The less a person eats and the more gas he produces. So, encourage your clients to eat regular meals. However, they should avoid overeating at any one meal. 6 small meals a day may be better than 3 large ones. Go slowly. Encourage new ostomates to add new foods to their diet in small quantities, just in case their bodies won't tolerate a certain food. Something that they may have been able to eat all their lives, they may not be able to eat anymore. Many ostomates find that they can eat nearly any type of food in small amounts, especially if they drink plenty of water. Water everywhere. Remind your clients to drink plenty of fluids, about 2 quarts per day. This is especially important for people with urostomies and ileostomies. Woo! What did you eat? The amount of odor produced by bodily waste is affected by the type of foods a person eats. Certain foods are known for increasing odor. These include cabbage, onions, egg yolk, and fish. If odor is a problem for your client, suggest that they avoid these problem foods. Try these instead. These are certain foods to help control odor too. Your client may notice a pleasant difference if they're eating daily servings of yogurt, parsley, cranberry juice, and buttermilk. Take it easy. Some foods have a reputation for increasing gas, so your client may want to limit how much they eat. These foods include cabbage, green beans, onions, beer, peas, melons, carbonated beverage, and cucumbers. Who knew cucumbers, huh? And take it slow. Tell your ostomy clients they can avoid excess gas by not chewing gum or gulping their food. And flatten it. If your clients enjoy the taste of carbonated beverage but are afraid of getting gassy, try sprinkling a dash of sugar into the drink before serving it. This causes the beverage to fizz up quickly and then go flat. Lighten it. A high-fat diet can make stool more liquid and harder to control. It may also produce more gas. Buttermilk. Some people find that buttermilk soothes an irritated digestive tract without causing diarrhea or constipation. We're on the last page. What's an interostomal therapist? An interostomal therapist, or ET for short, and we have an ET nurse that works here, is a healthcare professional who has specially trained to work with people before and after ostomy surgeries. They assist with the physical, emotional needs of ostomies. So if you ever heard anybody talk about an ET nurse, that's what it is. They specialize in ostomies. Is an ostomy always permanent? No. Sometimes surgeons create an ostomy with the hope of reversing the procedure in the future. The ostomy gives the digestive or urinary system a chance to heal from either disease or trauma. After a few months, another operation is performed to hook up the normal anatomy again. An ostomy is permanent when parts of the digestive or urinary system have been removed or were never present in the first place. And we're going to go down to the last one. The stomas I've seen are so red. Is that normal, or does the stoma hurt? Most stomas are created from a piece of the intestines. Intestine tissue is normally very red, but it has no nerve endings, so the stoma does not hurt. All right. So, let's go to the test. All right, number 1, an ostomy creates an opening in the body called stoma. Good. Let me just do. The word stoma is Greek for mouth. Did you know that?
Mouth?
Yep.
Mouth. Just like opening.
An ostomy located in the stomach is called a
Gastrostomy.
gastrostomy. This type of ostomy is used for feeding, while others, like colostomies and ileostomies and urostomies, are used for elimination. Your client ate coleslaw and fried fish. Seems like a good dinner to me. And now is complaining of foul odor and gas. Which of the following would you recommend to reduce his symptoms?
Cranberry juice.
Cranberry juice. Other options include yogurt, buttermilk, and parsley. You ever wonder why they put that parsley on your plate? When you go out to eat and there's parsley always sitting on your plate, you need to eat it afterwards to help.
Those decorations.
Eat it next time, it doesn't taste very good. All right. 4. It's hot and your client's plastic ostomy bag is causing him to sweat and develop a rash. What can you do to give him some relief?
Apply some powder.
Put a fabric between the bag and the skin.
Yes, D. Place a fabric between the bag and the skin. There are pre-made ostomy covers available, but a homemade one can work just as well. Alrighty. Number 5, false. Not all ostomies are permanent. Sometimes surgeons can create an ostomy with the hope of reversing the procedure in the future. Number 6, when clamping the bottom of an ostomy bag, you should roll the end of the pouch over the open clamp twice, then close the clamp securely. False. You only do it once. It says place the clamp 1.5 inches from the bottom of the pouch, fold the end of the pouch over the clamp once, and close the clamp securely. Number 7, normal stomas are bright red and bleed easily. It's actually true. That's the last thing I read. Normal stomas are bright red and bleeding. It didn't say anything about bleeding, but it's normal. Your client should be very gentle when cleansing their stomas. If you notice more than a drop or 2 of blood, tell your supervisor immediately, or the case manager. Most stoma-related skin problems are caused by poor hygiene practices. False. Most stoma-related skin problems are caused by poor fitting ostomy appliances. Number 9, most ostomates need to empty their pouches 3 to 6 times a day. True. Most ostomates need to empty their pouches 3 to 6 times a day. It's important to empty the bag before it becomes too full to avoid leaking or a bag blowout. And it's common for people to feel angry and embarrassed about their ostomies. True. It's common for people to feel angry and embarrassed about their ostomies. Psychological and emotional issues like grief, depression, isolation, I'm still talking, and shame are common among ostomates. Any questions? No? Alrighty, go ahead and make sure you sign it, date it, and then you need to fill out the evaluation in the back, please.
And tape doesn't hurt, because I used to have one that each time I would tape it would come off. I'm gonna take it off.
Their skin would come off with it.
There was blood.
Yeah, so you have to take it very slow.